Hello, my name is Loretta Elder, and I'd like to welcome you to my presentation on my proposed capstone project, Simulation in Assisting Nurses to Better Recognize Early Signs of Clinical Deterioration of Clients. The healthcare problem I will be addressing is that lack of the nurse's ability to recognize those early signs of clinical deterioration of clients. The healthcare problem is applicable both to new nurses, those new graduating nurses who ultimately get put on the night shift, as well as seasoned nurses, as failure to rescue events are becoming higher and higher. The problem is important in order to help nurses to rescue clients, and ultimately without proper intervention, those failure to rescue those clients ultimately lead to client death. My literature review supported the problem as well as the project. We all know that an expectation is that the nurses are expected to be able to monitor clients and identify changes in a client's condition. Failure to rescue outcomes are now included in organizational measures to assess how nurses intervene with emergencies. I want to share three studies that I feel like support my project and the problem. Askew and others studied 45 nurses. Each team was put through 2 simulation scenarios. Prior to the simulation scenario, the organization was experiencing 3 to 4 failure to rescue events per month. After the simulation, 1 year later, after that educational center intervention, they experienced no failure to rescue rates. Also, what they found was notification of that rapid response team increased by 60%. And rapid response teams are great and have shown to help with failure to rescue events. However, the nurse must also know when to call that rapid response team. Another study was Kinsman and others studied 34 RNs on a medical surgical unit. They used a simulation program called First Act of patient to look at patient deterioration. And what they found in their study is that after the First Act simulation program, nurses' management in the frequency of observation of clients improved. Also, Lindsay and Jenkins did study BSN students, however, instead of nurses. They studied 79 BSN students who were scheduled for a clinical simulation event day. What they found was higher post-test and knowledge after the innovative simulation event. The facility that I have chosen to do my capstone project is Baptist Health in Madisonville. It's a 410-bed facility. I plan to do my project on the medical surgical unit. For a couple of reasons. I've already talked with the chief nursing officer and some of the unit directors, as well as the nursing education coordinator, and they do see that there is a need for more education for those nurses who have been there for a while, as well as those new graduating nurses that are put out there on those night shifts. Also, the nurses complete a needs assessment every year for nursing education. And always in that needs assessment, they have found that the nurses ask for more education on the rapid response teams, codes that happen, medical codes that are called on patients, and so we see that they are asking for more also. Simulation is also rated as one of the highest ways of learning by those nurses at that facility. The team would include, my project would need to have a team that would meet regularly, and to plan the intervention, the team would include a unit director and an assistant director of that unit, the bedside nurses, of course, in the day-to-day work. Supportive staff would include information technology, as they would be the people that would help with that high-fidelity simulation event. Also, plan operations to help create that simulation environment so that is similar to the everyday workings of the nurses. Respiratory therapy would be involved, unlicensed assistive personnel and their supportive role, as well as the unit clerks. Rapid response team members and nursing education, of course, would be involved. The plan would include creating a simulated medical surgical unit for the simulation education intervention, similar to the everyday workings of the nurse. And also it would entail creating a simulated scenarios, and that would mean that an assessment of the frequent or not so frequent, maybe those high risk, low volume scenarios that have happened that nurses might need a little more help with. So we want to create scenarios, and also we would want to offer the educational opportunity at a good time for education, not during a high vacation time or holiday time, those type things. The project would include assessment pre-intervention as well as post-intervention for knowledge and confidence. Once we determined what we were going to do, once we had the simulation education intervention put together, we would want and have one simulation education intervention. We would want to examine what happened, both those expected and unexpected things that happened, so that we could analyze that data and then plan and refine the project and improve for the next intervention. Measurement for indicators for improvement. I have a couple of objectives. One would be to increase the knowledge, confidence, and skill performance during a need to rescue event. Most of the studies that I looked at use pre and post knowledge tests as well as a questionnaire to assess nurse confidence level. So I would need to find or to create a pre and post knowledge test and self-assessment of confidence pre and post intervention. And then I would like to find a good simulation tool to assess the skill level of the nurses. Objective 2 would be to decrease the failure to rescue events of the facility, and that might include doing some chart reviews pre-intervention and post-intervention, and to follow those rates as the hospital records those. I would use the SPSS package to analyze my data. I would need to run some descriptive statistics to compare demographic data both pre and post intervention. I would also run a paired t-test to compare pre and post intervention measures also for my study to see if we had a significant improvement. Also, the hospital data would need to be studied pre and post intervention. I'm excited about my study. I welcome any questions, or if you know a good simulation tool or you have any information you want to offer me or give me any tips for improvement, I appreciate it, and I look forward to working with you in the future. Thank you. You may also email me any questions that you might have about my presentation. I'd be glad to answer them through the college webmail. Thank you.